Well, I'd always been interested in medicine, but watching the video, the surgery through Imagine You, I think is what really cemented my desire to go into the medical field. Prior to that, I'd only been exposed to medicine through TV shows like House, but actually seeing it happen, it got me thinking that, this is really interesting. This is something that I can see myself being involved with professionally. And it was a knee replacement surgery. I think it really opens people up to the reality of medicine that otherwise wouldn't have access to that kind of knowledge, in high school. I think if they'd get to experience something like that, it would show them what it's really like, what they can expect to deal with. So I was looking into both nursing and radiologic science at UC. I went to UC on one of their innovation days, and they had little events where you would go and you'd talk to professors, and they'd explain about the profession and what it entails, what you can expect. And radiology just really stuck with me. I found it fascinating from a science point of view, as well as with the patient care aspect. I like that I get to work hands-on with patients and interact with them. In high school, I took a lot of science courses, anatomy, physiology, chemistry, biology, things like that, as well as some upper-level college and AP courses. So going into UC, I was actually a little bit ahead and was able to, for the first couple semesters, take a few extra classes that I just kind of wanted to, like microbiology, things like that. The curriculum for the radiologic science program was also very science-oriented, more anatomy and physiology, radiation physics, and that just really clicked with me. I usually get here in the evenings or later on at night. Day shift versus night shift is a little bit different. It tends to be a little more laid back at night. We don't have outpatients that are coming in as well as people coming through the emergency department. But it can get very hectic sometimes. At night, that's when you see a lot of the traumas and real emergency cases coming through. It can be very high stress sometimes. General is a level 1 trauma center, so you can see some pretty terrible things come through the door, but when people make it in and they recover and you get to help be a part of that, it feels really nice.